Hi everybody, this is Venk with Always on EM. As you know, I'm in Las Vegas at the Research Forum at ACEP. I bumped into Taiba and I'm really excited to learn more about you and your research.
Nice to meet you. I'm Taiba Alqatami. I'm an emergency medicine resident from Kuwait. I'll be talking to you about implementation and evaluation of rapid ultrasound shock for hypotension protocol training course in Kuwait. It's the first of its kind in our country. The rapid ultrasound for shock and hypotension protocol is a vital source that we use in the ED for undifferentiated shock. It's used in the assessment and dynamic monitoring of undifferentiated shock.
Yeah.
In Kuwait, we've just recently implemented POCUS as a core competence for our residents, but we are also recommending it in the ED for our physicians. The only issue that we have is there aren't enough trained physicians that can apply POCUS.
Okay.
So the objective of this study was to implement a comprehensive rush protocol ultrasound workshop to enhance the emergency physicians and healthcare workers' competence and confidence in performing the rush protocol and applying such a course. Of course, later on we might expand onto that to other POCUS components. So the method that we've had is we had a comprehensive full-day structured rush protocol ultrasound workshop that included didactic lectures followed by a live demonstration and then on to hands-on practice. We had a ratio of one instructor to 3 to 4 participants, around 4 to 6 stations, each with a live SP and a different ultrasound machine so they can have a varied experience.
Nice.
We had, over the 2-year period, 6 workshops that involved 89 participants, most of which, as can be seen, are emergency physicians. But we've also had paramedics, we've had nurses, we've had a biomedicine engineer. So there's varied experience in applying POCUS.
Okay.
The data analysis involved were 2 methods, the 2 sample paired t-test for means,
Okay.
and the difference method. We applied both just to see the difference method emphasized a net change. So even if they had a varied experience and started off at a different starting point, we can see the net gain that they've had.
Nice.
As the result can be seen, we've assessed 3 different components. The first one is their confidence in performing the rush exam without supervision after we've taught them the rush protocol. And the second one is the interpreting the ultrasound images of the rush exam without supervision after they've applied the protocol. And the third one is their ability to use the rush exam to form a diagnosis with their interpretation for hypertensive patients. And as can be seen in those graphs that are circled with blue, there is a mean improvement in each of them, at least 1 to 1.5 mean improvement. And with the difference method, you can see that in each of the components, they've gained at least 1 to 2 points in a gain. So in conclusion, the implementation of a structured single-day rush protocol workshop in Kuwait significantly improved healthcare workers, even though they were varied in experience, improved their skills and their ability to apply it for undifferentiated shock. This emphasizes the need for such training courses in Kuwait with regards to POCUS. And for further research, we would like to take this further and assess its impact on actual practice. And we plan on doing that by following this up in 3 months.
Wonderful. Taiba,
Thank you.
this is fantastic. I'm an ultrasound person. I did fellowship training in ultrasound. I was the director of Mayo Clinic's ultrasound program for several years, and the rush protocol is near and dear to my heart, so this is wonderful. Congratulations on what you're doing.
Thank you very much. We decided to use that because it definitely uses multiple components of POCUS with shock, which is one of the most common diagnoses in the ED. So we're hoping to expand on that later on and apply more training courses.
That's awesome.
Yeah.
Well, congratulations. Thanks for sharing your work.
Thank you very
I hope you have a
much.
great time here in Vegas.
Thank you. You too.